Hi, did you know that every face has 3 cosmetic units? The cosmetic unit of the eyes, the nose, and the mouth. But since we're all wearing masks almost all the time, we will focus today on how we can use cosmetic dermatology to improve mask face and make our eyes look better. So let's get really specific here. First of all, what can we use? What products do we have available? Well, one of course is Botox. So let me go over all the things we could do around the eye to make the eyes look better. First of all, we can inject what everyone knows, Botox, along here where we have the crow's feet. And when we do Botox there, crow's feet that you see just disappear in about 2 weeks. Another fun thing to do with Botox is if someone has sort of a droopy eyelid, we can put a little Botox right here and they'll get a little bit of a lift, so there's more of a show. When you put your mascara or your eyeliner on, you can see more of the eye. So there's more you can do with it if you're a makeup artist or just making yourself up. Another thing we can do with Botox is to get rid of the little 11 lines or worry lines. Laura doesn't have any, but if she did, I would put a drop here, here, and here, and this would just smooth out in 2 weeks. Also, what we could do, let's see you move your forehead muscles. Great, so you can see there are a few horizontal lines there. In someone like this patient, I probably wouldn't do Botox because at rest, she has a perfectly smooth forehead. And so I'd probably send her home on that one. But if someone did have deep lines on the forehead, I would do little drops across the forehead to about there, and then a little bit here to lift. And that would give a smooth forehead and more focus on the eyes. So let's talk a little bit about the size of the eyes. So for people who have eyes that they'd like to just be slightly bigger, you can put one little drop of Botox right here. And what it will do is make the eye look a little bit bigger in pictures. Another thing that we can do with fillers around the eyes, which would be, in this case, Restylane, which is a clear liquid, almost like a gel. The scientific name is hyaluronic acid. And you can see it's clear, so when you put it under the skin, all you can see is the result, the sculpted result. You don't see the filler. So if I were to do a little filler here in Laura, that would bring her cheek up just a little bit like that. And of course, she doesn't need that, but some people come in and they're very hollowed out here. A mask on the face will, of course, bring more attention to the unit of the eye, the eyebrow, the forehead, and right here. And so in summary, we can change the shape of the eye a little bit. We can lift the brow. We can smooth the forehead. We can make your children think you're not angry by erasing the expression line here. And we can make the size of your eye just a little bit bigger. So we have 3 cosmetic units, the eyes, the nose, the mouth. But these days, it's all about the eyes. This is Dr. Colbert at New York Dermatology Group.